feeling chest tightness, or a persistent cough. Not all respiratory issues are the same. Today, we're diving into the crucial differences between bronchitis and pneumonia, two conditions that often get confused but require different care. Imagine footage of a busy clinic, a healthcare professional listening to lungs, and patients receiving treatment. Bronchitis typically causes a cough that lingers, mucus production, and mild fatigue. In contrast, pneumonia often brings sudden high fever, sharp chest pain, difficulty breathing, and a severe cough with pus-filled sputum. Recognizing these signs can be life-saving. Whether you're coughing nonstop or struggling to breathe, knowing the symptoms helps you seek timely medical attention.